Good morning. I'd like to thank you all for being here today as we come together and learn from subject matter experts on how we can play a role in the fight against the opioid and fentanyl crisis. I want to let you know that we do have ASL interpreters here today, and this webinar is also being live streamed on Facebook Live on CDE's page. And this webinar is also being recorded for future use. Opioids are the fastest growing cause of death in our state, and just last week, in fact, in Riverside, California, a student stopped breathing in the main office. While school staff administered CPR while preparing a defibrillator, her pulse returned. When emergency crews arrived, they administered Narcan on suspicion of a drug overdose. Shortly after, the good news was she regained full consciousness. Thankfully, staff was prepared and trained and knew what to do. Today's event will include experts from the USDA, U.S. Substance Abuse and Mental Health Services, the California Health and Human Services, and others. And panelists will share information on ways we can work together to educate, prevent, and intervene to support and protect students. With that, I'd like to introduce a tireless advocate for the health and well-being of our state's nearly 6 million students, a champion for equity and safe schools, State Superintendent of Public Instruction, Tony Thurmond. Thank you so much for convening us here today and bringing much needed attention to this important issue facing our state. Superintendent Thurmond.
Thank you, Deputy Superintendent Guillen, and to your team for helping to facilitate today's conversation and for the conversation that we're having with schools. I was asked recently, how much more can we ask schools to do as it relates to guidance that we've put out for schools on how to respond to the opioid crisis and specifically the dangers around fentanyl. And while it's true that this goes beyond the normal pale of what schools do, the reality is that, as you heard from Superintendent Guillen, many young people are dying at very high rates. Any loss of life is just too much. And so this has become, unfortunately, a sad reality that schools have to contend with. And so we have to be active in awareness and aware and finding ways to support California students. And we have resources that can help to save a life. And so this webinar today, you'll hear from many partners. You'll hear from educators. You'll hear from family members. You'll hear from those who work in the public health space about things that we can do to prevent, to educate, to intervene, to treat. This is an opportunity for us to come together across multiple sectors in education and public health, law enforcement, drug and alcohol, substance abuse prevention and education. We must come across all of these sectors to find ways to help our young people. And we intend to engage the voices of young people in the future in how we reach other young people for our messages in prevention. Schools play an important role. Per California law, schools offer substance abuse education prevention for students at many grade levels. And schools now have access to federal funds and state funds that can be used for programs that focus on prevention and education and intervention. At the same time, California is making an incredible resource available to our schools, and that is Narcan, that can be used to intervene if someone is experiencing an opioid overdose. As you heard from Superintendent Guillen, this is in many ways similar to the things that we do to keep students and staff safe on campus. We hope we never have to use it, but on all of our campuses, we have defibrillators, which creates an opportunity for us to create a way to save a life in the event that someone is struggling and needs help. And that's the same way we approach Narcan. I want to encourage our school leaders throughout the state to avail yourself to these resources that are being made available to you at no cost to you that can literally save a life. It doesn't fall just on schools. And so we're partnering with everyone that we can to find ways to prevent and educate, intervene and treat, and work to save lives. So please stay tuned for today's conversation and future conversations and the resources that we can provide, like the $7.9 billion that schools are receiving as we speak and a discretionary block grant that they can use from many resources to support our students. I want to thank all the partners who are here today for sharing the good word. This is a job that we all must do. Educators and administrators, parents, students, health experts, we all have to work together if we are going to win as it relates to educating, prevention, and saving lives. So thank you for being here today to be a part of the conversation about the role that California schools can play in saving lives. I'll turn it back to you, Deputy Superintendent Guillen.
Thank you, Superintendent Thurman. Thank you so much for your leadership, and thank you for convening this important webinar today. And thank you for all that you do. Next up, I'd like to introduce our U.S. Administrator for the U.S. Drug Enforcement Agency. Administrator Ann Milgram is here to join us. She was sworn in as the DEA Administrator on June 28, 2021, after being confirmed by the United States Senate by unanimous consent. As Administrator, she leads the agency of more than 10,000 public servants, including over 4,000 special agents, 800 intelligence analysts who work in 239 offices across the U.S. and 92 foreign offices across the globe. Thank you, Administrator Milgram, for being here and joining the fight against the opioid and fentanyl crisis.
Thank you so much for having me. And it's really a privilege to be with all of you today. I want to talk about urgency. I want to talk about the threat, and I want to talk about gratitude. Let me start with urgency. We have never, ever been at this moment before. Last year, the United States experienced 107,622 drug poisonings, a catastrophic loss of lives. And so every day at DEA, we're thinking about how do we save lives and how do we prevent anyone from dying and being killed from fentanyl. So when I talk about urgency, I often will say, or I'll ask the room to raise their hand if they're between the ages of 18 and 45. And I know we can't really do that online, but if you think to yourself about this population, 18 to 45, and then you look at the statistics that we're now seeing out of the CDC, you'll see that we know that the leading cause of death today in the United States of America is drug poisonings. About 70% of those are attributable to opioids like fentanyl, and about 30% are methamphetamine. Again, these are the drug poisoning deaths. This does not even begin to take into account the hundreds of thousands of other experiences that individuals have where they do have an overdose event and they're able to survive because of Narcan or other tools. So again, just thinking about the scale and scope that we now in the United States have more people dying between the ages of 18 and 45 from fentanyl and methamphetamine than are dying from car accidents, from suicides, from COVID, and from other diseases. To step back and talk about fentanyl just for a minute, I often say that fentanyl is the single deadliest drug that the United States has ever had widespread. The DEA has seized fentanyl in all 50 states, suburban, rural, and urban. It is everywhere. And this is particularly important as we talk to one another about this threat, because anyone who has a smartphone, anyone who has access to the internet is now accessible by drug traffickers, by individuals who are often selling fake pills. And it is just a threat that we see widespread. Fentanyl, of course, is a synthetic opioid. It's man-made, largely using chemicals that come from China right now, from Chinese chemical companies, are being sent into Mexico where fentanyl is being produced. After that fentanyl is produced in Mexico, it's often being pressed in Mexico into fake pills that look like OxyContin or hydrocodone or Vicodin or Adderall. But in fact, those pills are completely fake. They're just fentanyl and filler, and they're killing Americans, and particularly young people and young adults at record rates. Importantly, fentanyl is 50 times stronger than heroin. We talk about that because we believe that the cartels are in some ways using this to drive addiction because it is so devastatingly strong. And so it's important to recognize that when individuals are encountering fentanyl, whether it is in a fake pill or whether it's being cut into other drugs. And across America right now, we see it cut into cocaine, methamphetamine, heroin. We see it basically cut into everything, often hidden. And so people don't know that they're ingesting it. When we see that happening, we know that it is so devastatingly addictive that the traffickers are either taking someone on a path to addiction potentially, or, unfortunately, so many tragic cases, people are not surviving. We talk about fentanyl, and one of the things I will often say is talking really matters. And so as we're talking about the threat now, one of the most important things we are trying to do is to raise public awareness about how devastating a threat that this is. Only a tiny amount, 2 milligrams, according to the CDC, is lethal. That's important because if you want to think about how to talk to students or your own family members or friends, I often will put 10 to 15 grains of salt into the palm of my hand and show people that is roughly equivalent to 2 milligrams of fentanyl. And that is enough to kill someone, and they will never, ever know that it's there. I want to talk for a minute also about fake pills, because when we talk about young people and fentanyl, we're often talking about fake pills. What we see, again, are the cartels, 2 cartels in particular in Mexico, Sinaloa and Jalisco, that are acting with calculated, deliberate treachery. So what they're doing is making fentanyl and filler into these fake pills that look virtually the same as a real OxyContin. And if you look at the example we've put up here, you'll see that you basically could not tell the difference in coloring, in shape, with markings between a true OxyContin and a fake OxyContin. We have chemists in our lab who have been doing this for 20 years, and they often can't tell the difference. And so again, we think it would be virtually impossible to expect someone, a young person or someone else, to know the difference on site. And again, what's really important to know is that these are so dangerous. 4 out of 10 pills that our lab, our DEA lab tests, have come back with 2 milligrams or more of fentanyl. That's a lethal dose. So someone who is purchasing what they believe to be an OxyContin on Snapchat, Facebook, Instagram, social media, Wicker, whatever that is, that they believe to be a real pill, the likelihood of that having it, first of all, it will be a fake pill. You can't also buy, it's important to know, you cannot buy legitimate pharmaceuticals on social media. So we know that that pill is overwhelmingly likely to be fake. What we want folks to know is that 1 pill can kill, and that 4 out of those 10 pills that we're seizing now contain a lethal dose. I talked a little bit about social media, and I think it's really important to stop for a moment on social media, because we see every single day, we are on all of these websites, and we see the cartels and we see their drug traffickers that are actively using social media to sell these fake pills and other drugs. And again, a lot of those other drugs are being cut with fentanyl. All of the sites that are up here, we are finding drugs on a regular basis. And so I think it's very important to understand that young people across the United States of America, young people across the California school system who have those apps, that those drug traffickers are there. We see some instances in where drug traffickers are geolocating people. We see instances where they're going into closed groups where, you may have a group of young people who are going to, for example, a concert. You'll have someone who has a remote connection who will come in and say, hey, I'll meet you at that concert. But the bottom line is we see countless ways in which traffickers are infiltrating and are on social media. We also have put out a code with emojis that can help parents, teachers, others understand that many times drug traffickers and their dealers will not say Oxy or they will not say Percocet, but they'll use coded words and coded language to essentially offer drugs for sale online and on social media. It's really critical. I think that we all understand that young people are exposed to this every day, and we have to talk about it because, anytime I have these conversations with young people, I find that they're on these apps, they're on these platforms, and they already know what's happening, or they already have a sense of there being traffickers out there or problems out there. What I think we have to do as good a job as any of us possibly can is having them understand that one pill can kill, that anything that's purchased on social media will have likely, very, very likely will have fentanyl in it. And we're seeing just these catastrophic and tragic, tragic deaths, drug poisonings, we refer to them as, happen across the United States every day. So I talked a little bit about urgency. How do we meet this moment? About the threat, which we believe is getting worse because there are more chemicals coming from China. There is more fentanyl right now being made in Mexico. We have turned our worldwide operations to degrade those two cartels, to defeat them, and we are actively working to do that. But I want to be clear-eyed in saying that there is no question that none of us can do this without making sure that we are prioritizing public awareness, prevention, treatment, and of course, enforcement. I want to close with a note of gratitude, both to the school system in California for hosting this conversation. All of us have to be talking. It's one of the most vital things I think we can do, is having these hard and difficult conversations. I also want to just express my deepest gratitude to the families who've lost loved ones, who have been able to take that grief and those tragedies and turn it into advocacy and public awareness, and are really making a difference in saving lives every single day. We now have 4,000 photos of individuals whose lives have been lost to fentanyl poisoning that lined the walls of DEA headquarters. And we've had the opportunity to get to know some of those families, including the remarkable Laura Didier, whose son Zach died from fentanyl poisoning. Laura has been an incredible leader. She's an inspiration to me. And I'm just so grateful to her and to all of you for taking this really important step forward to talk about the crisis we're facing and to talk about how we can work together to save lives. Thank you.
I sure appreciate that, Administrator Pilgrim. It is very gratifying to have these relationships. I tragically lost my 17-year-old son, Zachary, to a fake pill. It was December 27th of 2020. It was really prior to this rise in awareness that we've seen over the last year. We were blindsided by his loss. He was a senior at Whitney High School in the suburb of Sacramento called Rockland, California. Very safe and happy suburb. He had a wonderful childhood. Unfortunately, he is emblematic of this new demographic that we're losing, these young, non-addicted children that are encountering through social media primarily. With Zach, it was Snapchat, these counterfeit pills. To say we were blindsided by his loss was an understatement. It was certainly nothing we saw coming because he wasn't struggling with substance issues. But it was COVID lockdowns, and as we know, a lot of children were struggling with that and the loss of all of those things that they were able to do and engage in their regular life. So when we were given the confirmation that it was fentanyl, it did take an investigation because there were no pills found with him. He passed away in his bedroom at his desk. So we had to wait on the toxicology. And when we did receive that, Zach's father and I decided we wanted to be public about this. We wanted to be vocal. We didn't yet see any local awareness in our county because this problem was just starting to come to Placer County and Sacramento County in 2020, the year that Zach was killed. So I'd like to talk to you about the partnerships that we've been utilizing to get this information out and to warn our students. We find that in sharing Zach's story, it really resonates with other students because he was still in high school. They could see themselves, in his story. So we were limited in the beginning with COVID, but now we've been able, our county in Placer and Sacramento County as well, have launched our own One Pill Can Kill campaigns, which you can access by going to the numeral 1 Pill Can Kill Placer.com. There are wonderful resources there. We're working with other counties who want to do the same type of thing. We have health services, we've got the school districts, we've got law enforcement, bereaved families, all uniting around this messaging, because for so many of us who lost our kids this way, we know that it was not fentanyl that they were looking for. Whether through self-medication or curiosity, they were looking for something far less harmful, something that they recognized as a pharmaceutical, in Zach's case, a Percocet pill. So we are now actually able to go into schools. We've been in Placer County schools and Sacramento County schools doing assemblies around this, warning the kids, because I also believe, as the administrator said, that, and all of the panelists will say, that education is really our first wave, to combat this. I also work with a a family-run nonprofit called Song for Charlie. And we just did, with Breakwater Strategy over in August, we did focused research groups with students that you can reference the full breakdown of the data that was compiled on songforcharlie.org. And there will be a pop-up there. You can get all of that data. And what we're seeing is it was a study that was done in a year prior and then redone. And what we're seeing in that data is that as there's still a large amount of students that are not aware that fentanyl is in these counterfeit pills and that these pills on social media are not real. So there's a lot of work still to be done there. But in this past year, where there has been more public awareness, the students are self-reporting that they are more aware than they were before. So we know awareness is working. We know it takes coalitions to build together. I was Administrator Milgram put out an invitation last summer to bereaved families who were involved in advocacy work from all over the country so that we could join together, see how we could help each other, learn from each other, partner with the DEA. And Zach's father and I brought that back, to California. Other parents that came from other regions of California brought that back to get this information out, because information, especially for these young students, who aren't going out looking for what they know to be dangerous, the more dangerous street drugs. They're not, predominantly out there looking for that. But these pills with these recognizable trademark names, that is what our students are really vulnerable to. So I appreciate so much all of the experts on this panel. I appreciate my fellow grieving parents who are working so hard up and down California to get this message out, and we're just here to be a resource. And again, thank you so much.
Superintendent Guillen, if I could, I just wanted to acknowledge Lauren and the Didier family. Our hearts break for your loss, and thank you for being willing to educate others and to make Zach's memory be that of a legacy of helping others. Any way that we can be helpful to you in this cause, please let us know. And thank you for lifting up how powerfully important this work is in our schools. Thank you.
Absolutely. Thank you too.
Thank you, Lauren. Thank you for being here today and sharing your story. Again, really appreciate it. And thank you for helping countless others. I'd like to turn it over at this time to Dr. Soheil Sood, who's a pediatrician. He's with the California Department of Public Health, and he's with the LEAD Safe Schools for All office. So Soheil, thank you for joining us. And we also have Robin Christensen. So thank you for being here.
Thank you. On behalf of the California Department of Public Health and the California Health and Human Services Agency, thanks for having me. It's really an honor to be here and share the stage with brave folks like Lauren. My heart personally goes out to you and your family as well. Such a tragic loss, and let's see what we can do, as the superintendent mentioned, to do everything we can to turn this into a legacy of hope and resilience for our youth. Over the next few minutes, I hope to provide you with data and resources to address this ongoing crisis of fentanyl use and really poisoning of our youth throughout the state. And I want to start just as Mr. Guillen was just mentioning, just by acknowledging Robin Christensen from the California Department of Public Health's Overdose Prevention Initiative for her team's ongoing work in this arena. And I want to thank the superintendent as well and your whole team for your steadfast partnership on this and many other topics. There we go. So you just heard about the One Pill Can Kill campaign, and I will just underscore that in California, one pill has killed. Fentanyl has taken away the lives of far too many of our youth. You can see some of the statistics listed on the left here, which broadly show that over the past 3 or 4 years, just as has been mentioned, this problem has skyrocketed. Fentanyl-related emergency department visits have more than tripled among children ages 10 to 19 years old. And opioid-related deaths in children, of which fentanyl accounts for 95%, have increased fourfold in just a recent 2-year period. Administrator Milgram went through a number of points on the right, but just to underscore, fentanyl is cheap, it's small, it's easy to move, it's easy to manufacture. And the kids that are being harmed by it, they may encounter fentanyl through any number of channels, including from individuals selling fake pills in person or on social media. The numbers I just presented are statewide, as are the numbers on this chart here on the left, showing the substantial rise in fentanyl deaths in 15 to 19-year-olds in California. But I do want to inform health and education officials joining us today that California maintains a dashboard where you can drill down and find out more about what's happening in your county, broken down by age and ethnicity, by referencing the link that's bolded at the bottom of this screen. And we'll share out a broader website that folks can access to obtain this information. And of course, behind each of these data points is a tragic tale, such as that of Zachary. Many of these stories involve a child who didn't know what they ingested was fentanyl. And all of these news articles that I clipped and put on the right here involve situations just in the past few, are articles from the past few months. And to add to that, now we have rainbow fentanyl in California. Rainbow fentanyl really just refers to brightly colored fentanyl, which may be packaged as counterfeit pills or as powders or blocks that resemble sidewalk chalk. Law enforcement has found this type of colored fentanyl in California. CDPH is aware of seizures in Los Angeles County, in the Bay Area, and across the Central Valley. Lab testing shows that the drug itself is no different than fentanyl, no difference in strength or potency. It's really just a dye, but the colors are bright and maybe more visually appealing. The bottom line, though, is that any pill, regardless of its color, shape, or size, that does not come from a healthcare provider can contain fentanyl and can be deadly. So what do we do about this? Now, of course, it takes a comprehensive set of approaches to address this. It takes supply side measures to curb the entry of these drugs into our communities, as has been mentioned. And it takes measures for those using this substance, either intentionally or incidentally, being poisoned by this, so that we understand the drivers of use, raise awareness, and ensure that the right tools are at the ready. Schools are pivotal partners in this work. It's where kids spend 6 hours a day or for more than 12 years of their life. It's where peer networks are often formed. Coaches and teachers are among the adult role models that our youth often look up to. Personally, that was absolutely the case for me. So they're just pivotal. And so the California Department of Public Health has developed and curated resources specific to the school's community, including resources for educators and parents and other adult role models. And this information is being regularly updated. In terms of raising awareness, there is an active social media campaign going on and a toolkit that schools and other organizations can use to advance this messaging. I'll end this slide deck with the website again for folks to be able to visit and to take these images and associated text and use them in their various social media platforms, both as individuals and as institutions, to continue to raise the message and lift up this cause. And it also takes specific tools, which can and have been used in schools. So on the left here are signs of an opioid overdose, which can include an extreme inability to stay awake, slow breathing, a limp body, or cold or discolored skin. If these signs are observed, there's a couple of immediate steps that the Department of Public Health has outlined. And step one is call 911 and give naloxone. So let's spend a little bit of time on naloxone. Naloxone, also known in the nasal spray form as Narcan, is a class of medications that are known as opioid antagonists. These drugs bind to the opioid receptor in the brain, and they can reverse an overdose. They're extremely fast acting, can take seconds or even a minute to kick in. I've personally administered naloxone before with rapid effect. It's non-addictive, it's non-habit forming, it has no side effects if there are no opioids in your system. It's safe, it's easy to administer, and it's one of the best tools we have to save lives. We never want to have to use this, but we always encourage people who are in a helper role to have some available just in case, just like an EpiPen or, as has been mentioned, a defibrillator. These are real quotes from our community partners, examples of times when having naloxone on hand in a community setting has literally saved a life. The quote on the left is from a patient in a recovery program who saved a friend who overdosed. Quote at the bottom is from a girlfriend who saved her boyfriend's life. And the quote on the right is is about a teenager whose life was saved twice thanks to a family member who had been trained to use naloxone and who had it on hand. And that's why for over 50 years now, the harm reduction community has advocated for community distribution of naloxone. And so if your school is interested in obtaining naloxone, your first question might be, how do we get it? And the California Department of Public Health maintains a statewide standing order for naloxone. That order permits entities to distribute and or administer naloxone to individuals at risk of an overdose without an individual prescription. So what does that process look like? It's 3 quick steps. Step 1, either a school or a school district completes this online form. They check the box indicating that the organization agrees to the terms and conditions, and then take a training. And CDPH offers a free training video online available on the standing order website. And that's it. Your copy of the approved standing order will immediately appear, and it can be saved to your computer, and it's good for 2 years. The next step is, how do you actually get naloxone? And there's a few ways to go about this, including directly from the manufacturer for free or at discounted prices. But in a minute, I'll hand it over to my colleague, Madison Royer, who will describe a state-based program in order to obtain naloxone. Before doing that, I'll just say, as has been mentioned, it takes all of us working together to share practices and center our youth. And with that in mind, our work via the Overdose Prevention Initiative not only tracks data and trends, but works to build partnerships across the state and promote policy-based solutions to the overdose crisis. So here's a list of overdose coalitions. These are just the CDPH-funded coalitions, but there are additional programs statewide. And we recommend schools for whom this is new territory that they consider partnering with these fantastic groups, along with many other coalitions. We are also working to share best practices that those in the K-12 community have developed themselves, including school board policies, letters to their own communities, powerful public service ads. There's no need to reinvent the wheel here. And you can visit our websites to find and lift and use and customize some of this existing material out there. And relatedly, we've hosted a few recent convenings where school leaders have shared their experiences, increasing awareness and standing up naloxone programs. And we have slides and videos available for download at the link on the screen. And finally, our program's website is listed here, as is an email address you can use to reach us if you have any questions or recommendations for our program. So thank you so much. I will now turn it over to Madison Royer, who's a senior policy consultant at the Aurora Health Group, working with the Department of Healthcare Services on the naloxone distribution program.
Thank you so much. My name is Madison, and I will be speaking on behalf of the Department of Healthcare Services Naloxone Distribution Program. And I'm going to share the Naloxone Distribution Project, or NDP, website. And so this is where you will go to access the NDP application. And also you can find the instructions here. So I will just run through them quickly on how you can obtain free naloxone through the Naloxone Distribution Project. So this project was created to combat opioid overdose related deaths in California by the provision of free naloxone to eligible organizations. And on this website, we have a table of all of the organization types, and you will see right here in this first box that schools, K through 12 schools, and also universities are eligible to receive naloxone through the NDP. And so the way it works is you complete the NDP application. It's available on our website through this link. Sorry, it's up top. This link. It's a 2-page application, a PDF that will include your contact information, your organization information, the address where you would like the naloxone shipped, and also the number of units that you are requesting. And so the naloxone ships in packages of 12 units. Each unit comes with 2 doses. And so there's a minimum order of 12 units, and then requests must be made in multiples of 12, so 24, 36, etc. You'll also email a copy of your standing order, which you will receive through the California Department of Public Health, as we just reviewed, or a physician's prescription, either is acceptable. And then a copy of a valid and active business license, FEIN, or tax exempt letter from most schools. You can find that on your W-9. We will receive that documentation. And then if your request is for over 48 units, we'd like to see a distribution plan. So maybe if you are a larger school or a school district or county office of education that is going to be applying on behalf of multiple locations, you'd rather just submit one application than have all of your individual sites submit smaller orders. That's totally acceptable. We just ask that you outline that policy for us, how you're going to distribute those units, which site is going to get, how many units, so we can see that justification for a larger amount of units. And if you're applying again, we will want to see any overdose reversals, and hopefully it will not be needed. But these 4 documents, or maybe 3 if you're not ordering 48 units, is all that's required to receive naloxone. So you'll submit that to naloxone@dhcs.ca.gov. Our email is at the bottom, and it's also on the application form. And we will confirm receipt of that application. If you're missing anything or anything looks incorrect, we will reach out to you to make sure that gets corrected and you've submitted a completed application and everything looks good. And then within about 2 to 4 weeks, we'll notify you of acceptance into the program and how many units you've been accepted for. And at that point, we will take it from there. We'll pass your information along to the manufacturer of Narcan, Emergent Biosolutions, and they will ship the Narcan directly to your address, and you will receive tracking information and an estimated shipping date directly from that manufacturer. The reason that it takes about 2 to 4 weeks is because we are just receiving a huge amount of applications from all organizations across the state. And so we need a little bit of extra time for processing and to keep up with demand. As we just mentioned, there are other avenues to receive naloxone. Schools are eligible to receive naloxone through the public interest price through Narcan Direct directly from the manufacturer, so you can purchase it. Emergent Biosolutions, the manufacturer of Narcan, is also going to be distributing, I think, 2 units of naloxone to every public high school or school, K-12 school now in the country, and that should be available in 2023. And so when we have more information, we will definitely share that with your organization. So if maybe you don't need the full 12 units, because there is that minimum through this program, you only need about 2, you can access that resource as well. I will stop there. Again, you can visit this website for more information or contact us at naloxone@dhcs.ca.gov. I'd be happy to take questions in the Q&A or at the end if there's time. Thank you so much.
Thank you so much, Madison, for such helpful resources and presenting today on how to actually get the Narcan and naloxone as an organization for your local schools. Really appreciate that. Next up, we have Erin Ross. She's a nurse consultant here with the California Department of Education. She's going to talk about supporting the social and emotional needs of the whole child. Erin, thank you for being with us today. Take it away, please.
All right, so I just want to give a quick rundown for school nurses on how to implement a naloxone program at your school. And I know, unfortunately, not every school has a nurse. So if you don't have a school nurse, then just this is for anyone fulfilling that role on your campus. If you were around when stock EpiPens came into play and those yellow boxes showed up at your schools, this will be very familiar to you. The steps are pretty much the same. So most importantly, you'll need to consult your board policy for specific guidance. If no board policy is available, there are sample board policies available on the California Department of Public Health CDPH website that you can look at and model yours after if you're interested in creating one. Once you have the board policy in place, you can work on physically getting the naloxone and starting the training program for your school staff. You'll want to decide the who and where for the naloxone, so who will be trained and where will naloxone be stored. As was already previously mentioned, there's training resources available on the CDPH website, including videos on how to administer naloxone and some suggestions for storage for the naloxone once it gets to your school. You could put it in the bright yellow EpiPen box, which most school staff should recognize, or some schools have put the naloxone near their AEDs. And as far as getting the naloxone, the previous speakers already touched on that, but like they said, there's standing orders already available on CDPH website, and you can get access to naloxone through the manufacturer or the naloxone distribution project. I also want to talk about some other mental health resources we have. The first is Project CalStop, which provides violence prevention programs and mental health trainings, including the Sandy Hook Promise training and the Safe Promise Club. The Safe Promise Club is a student-led club to allow students to practice the lessons they learn, and they provide advisor and student trainings, regional club events, and there's an opportunity to apply for a stipend to support club activities. CalStop provides other programs as well, available on their website, which you can access on the link at the bottom of the slide. The next resource is Project CalHope, which supports student and staff mental health by providing free access to curriculum, teacher guides, and classroom materials and forms for educators, students, and families. More information on this project can be found at www.calhope.org. CalWell is a project funded by the Substance Abuse and Mental Health Services Administration to expand access to school and community-based mental health services. One program CalWell supports is the National Alliance on Mental Illness on Campus High School Club, which are student-led clubs to increase mental health awareness and reduce stigma. They receive support from the National Alliance on Mental Illness California, which provides orientation, trainings, and sample club activities, and the clubs are also eligible to apply for a $500 mini grant. CalWell also delivers at no cost youth mental health first aid training. So this is an interactive research-based curriculum designed for adults who work with youth and includes 2 hours of self-paced learning prior to the instructor-led portion. For more information on how to bring this training to adults near you or other services provided by CalWell, you can access the website using the link at the bottom of the slide. And these slides will all be accessible after the presentation, so you'll be able to get access to these websites. And again, I just wanted to formally introduce myself. My name is Erin. I'm the new school nurse consultant for the California Department of Education. I'm available to help answer any questions about anything that I've talked about, assist school nurses and school staff with implementing stock naloxone programs or any other school health related questions you might have. I can be reached through our general email address, which is wellness@cde.ca.gov, or you can reach me directly at eross@cde.ca.gov. Thank you.
Thank you, Erin, for being here, and thank you for being a resource to our LEA partners, and welcome.
Thank you.
We just threw you into the fire, didn't we?
Yeah, that's fine. That's what I'm here for.
Fantastic. Next up, representing our LEAs, we have Doreen Khatib. She's an administrator of the Health and Wellness Education Programs from the Orange County Office of Education. We're lucky to have you. Thank you for being here.
Thank you for having me. I'm really excited to talk a little bit more about prevention that was already mentioned and that upstream approach to supporting our students and our families. So I'm going to talk to you a little bit about health education, and just want to acknowledge that health education is part of our whole school, whole community, whole child approach to providing supports that meet the needs of the whole child. It's also part of the California multi-tier system of support framework as a universal support for all students across all grade levels. and also an important component of our California Community Schools partnership, and really looking at this as a part of integrated supports to meet the physical, mental, and social emotional health needs of our students. I'm representing the Orange County Department of Education, but I also want to acknowledge that we do have a statewide health education community of practice with colleagues across the state, hoping to support all of our educators who do the great work of providing our students with health education. So I'm just going to give you a quick California health education at a glance. We do have standards for health education, content standards like we do for other content areas. There are clear descriptions of what our students should know and be able to do at the end of each grade level. We also have a new framework that was just adopted in 2019. And if the standards tell our teachers, our educators, our instructional aides what they should be teaching, then the framework is really guidance on how to teach the standards. And it's updated with some incredibly important information, but also great resources and supports for our educators doing this really important work. The aim of health education is to ensure that our students are health literate. So what does that mean? What is health literacy and why does that matter? Really what we're hoping to do is build skills, build our 21st century skills that we talk about that are so incredibly important for our students. We want them to be critical thinkers. We want them to be problem solvers. We want them to be self-directed learners. Not only do we want them to have very important health information, but we also want to make sure that they know what services are available to them and how to access those services, which is incredibly important. And I think that's really a beautiful component of health education, that although it is very much all about knowledge and skills, and it's about instruction and building those skills in our students, there is a beautiful partnership and an opportunity to partner with our service providers, our mental health professionals on campus, community partners who provide support around substance use prevention, around mental health, around stress management, and a really great opportunity to build the skill of how to seek help and how to actually access help for yourself, for your friends, for your family, a really important piece of the comprehensive health literacy approach. We also want them to be effective communicators. We want them to be able to translate what they know into their actual practice, into their actual behavior on campus, in their community, at home. And of course, we want them to be responsible, productive citizens. And that's really the idea of how them being healthy, there's also an opportunity for them to advocate for the health of their families and their school community and their greater community as well. Health education is a part of California education. In grades 1 through 6, we do have ed code that says students are going to get health. And I just want to clarify that health is not taught in physical education. They are separate content areas with their own standards. And I just really want to acknowledge that it is a great opportunity to integrate into the younger grades, a great opportunity to reinforce a lot of our literacy efforts and to reinforce a lot of our science. There's great opportunity to teach a lot of the concepts in health, even in social sciences. And if you look at the bottom of the slide, we have health education in elementary schools. We have a quick one-pager on what that looks like and the best practices around the instructional delivery models for lower grades. We also have the same resource for middle and high school. And although health education is not required in middle or high school, it's really up to the local educational agency to make that decision. We do have a lot of required components, required content that's health related that has to be taught in middle and high school. So what are we teaching? And we're really wanting to build the health literacy of our students by enhancing their skills. So if you look to the bottom of this visual, essential concepts is really this first standard in health education. We do want them to have information. There was such great information that was shared by the DEA by also CDPH, as well as Laura, who gave a really great perspective of that family knowledge that we want to build together. And we do want students to have that. That's incredibly important. Knowledge is very, very powerful, but we don't want to stay in just giving them information. We want them to do something with that information. We want them to analyze what are some potential internal influences, external influences that are influencing my health behaviors or why I do what I do. Where am I getting my information? Valid health information. That is so incredibly critical as we talk about how a lot of our students are learning and accessing so much over social media. We want to build up their skill to understand that not everything you read is accurate. And how do you do that deep dive to make sure that that information is valid and that is credible? Interpersonal communication. That's so critical for collaboration, but it's also critical for refusal skills, negotiation skills, how to ask for help. That is really, really essential. Decision making. What does that mean? When we tell students, make good decisions, how that doesn't miraculously happen. That's a skill that we have to develop, that they have to practice, and that becomes more sophisticated as they get older. Same thing with goal setting. Let's set a goal. Let's actually go through the steps and the cues, which also is a huge component that we naturally do in academics, but very, very important for health as well. And then we want to give them a chance to practice those health enhancing behaviors. We want to create healthy school environments where students have access to practicing what they're learning. And then health promotion is really, as you see, as the skills get more sophisticated, health promotion is that advocacy piece, that piece that Laura talked about. How do we support our students to advocate for their own health, to advocate for the health of their peers, to advocate for the health of their families, and to advocate for the health of their community? And I want to pause here for a second because health education standards have a really great alignment with social emotional learning competencies. It is clear that you see, as far as decision-making and goal settings, which is a part of self-management, there's a beautiful fit there. The interpersonal communication is a great piece that reinforces the social emotional competency around relationship skills, definitely self-awareness, social awareness, that's the analyzing influences piece. So there is, when we're teaching health education and it's standards-based, skill-based, we really are also reinforcing explicit social emotional learning and that building of SEL competencies in our student as well. So health education, we have 6 different content areas. And as you can see in our conversations today about substance use and substance use prevention, we have one content area all about alcohol, tobacco, and other drugs. But I want to pause here and acknowledge that the wonderful thing and the opportunity with health education is as we teach students skills across all content areas, skills are transferable. So once you have a really foundational knowledge of impactful decision-making that's going to help support your health, that is just as important in alcohol, tobacco, other drug prevention as it is in mental, emotional, social health, as it is in nutrition and physical activity. So when our education efforts are skill-based and they're really taking the time to support the skill development of our students, it's transferable. It's going to support all of their whole child health needs and really building that across all of their behaviors. So what do we teach? This is a visual right out of our content standards for health education. If you look to the very left, that's our grade levels, and at the very top is the 6 content areas for health education. The one that is highlighted for you in orange is alcohol, tobacco, other drugs. We do have standards that tell teachers what to teach in kindergarten, in grade 2, in grade 4, and of course in middle and high school across all those grades. And what does that look like? So how do we teach that information? Sorry, this is hyperlinked. It was going to take you directly to the standards. So how do we teach about alcohol, tobacco, and other drug prevention, substance use prevention in younger grades? You'll see here the top reddish piece is really those essential concepts. We want to talk about how medicines can be helpful and they can be harmful. We want students to be able, as they get older, to distinguish between what is helpful, what is harmful. And as they get older, understanding the differences between medicines and illicit drugs. And then as they get older, they're looking at what does misuse mean of prescriptions and non-prescription medicines. So of course, it gets more scaffolded, it gets more sophisticated as they get older. And then a lot of our middle and high school lessons are very explicit when we do talk about different substances. But we don't stop there, right? We are wanting to build their skills. So another example is we look at skill development. So interpersonal communication skills that are reinforced across the grades. We want them to build their refusal skills. We want them to understand what that means. We want them to actually practice that. Practice the skill of effective verbal and nonverbal refusal skills. But we also want them to goal set. We want them to make a plan. It was brought up in some of the Q&A about, well, what are we doing about why students might be curious about substance use, and really understanding that and thinking about, well, how are we supporting their stress management? How are we supporting their comfort seeking behaviors? How are we supporting them with coping strategies and their overall wellness efforts, and really helping them build a plan for what are healthy behaviors that are going to support my physical, mental, and social emotional well-being. And then finally, the last, looking at practicing positive alternatives. So really giving them that reinforcement that what does that look like? And let's actually create opportunities on campus where we can practice those healthy behaviors and support one another, and where the adults are modeling, but also there's peer-to-peer modeling. And as I already mentioned, when we're covering substance use prevention, we're really also talking about injury prevention and safety. There's all of this cross-content area opportunities to reinforce the learning for our students. And no-brainer, huge piece around connecting between alcohol, tobacco, other drugs, and mental, social, emotional well-being when we're explicitly talking about stress management, coping strategies. Also finding a trusted adult. So how do I ask for help? Who can I talk to? And giving students the tools on what that communication looks like. And as I mentioned, this is also an opportunity to link our universal support, that tier 1 service for all students, with additional tier 2, tier 3 supplemental supports and intensive supports that are available on campus and in the community, linking those opportunities for our students so they're seamless. So not only are they more likely to seek help, but when they do get services, they're getting the most out of those services. And I want to also emphasize that it doesn't just stay in the classroom. There are so many different ways that when we're talking about the health of students, it's relevant. It's about them. They could bring their stories, they could bring their identities, they could bring their background and their diverse viewpoints to these conversations about health and health behaviors and different practices that enhance health. And there are so many different ways that we could do that on campus, whether it's through service learning, whether it's building our skills in our students around peer-to-peer education, which is so incredibly powerful. Media literacy, again, we keep talking about social media. It is incredibly important that we engage our youth so they have a say on what their peers should be looking out for, and ways that they could really build an opportunity for credible health information through different outlets that they know peers are accessing. And then, of course, advocacy. There are so many ways that we could build leadership skills in our students and support them in a way that's meaningful, that is also going to help provide them with support and leadership opportunities that are going to advance their well-being as well. And then, of course, shout out to family engagement, incredibly important opportunities, which has already been mentioned by many of the speakers on this webinar, that we have to support our families, but this is also a great way to engage our families. And what educators could do is really ensure that we're providing support for how families can talk to their kids about opioids, drugs, all and anything related to this very, very important topic that we're talking about. And really, us as educators encouraging our families to start the conversations young and keep the conversations going. CDPH has already shared a lot of really great information. The DEA has also shared great information, and Laura shared some links as well. And I'm just adding to that some additional resources for you to explore. There's some great tips and really easy to use information on the Partners to End Addiction website. And then I'm going to share additional resources specifically geared towards educators. So we did develop a lot of really great resources that educators could take and implement in the classroom or in the school community for that skill development piece. So these are all grade specific. So we have them from, TK all the way up to 12th grade. What does that mean to develop skills in students? So how do I teach analyzing influences? How do I teach goal setting? These standard guides have already been created, and they're all available, open access on the California Health Education website. It is californiahealtheducation.org. It is linked in the slide deck, and you'll get access to this slide deck. But I want to just make sure that you know that these are available. We also created student-facing posters that really support the model cues that we're trying to reinforce with our students for that very important skill development. We've created model learning activities, specifically what is standards-based instructional design? What does that look like when we're talking about teaching different health concepts? All of the learning activities that were created align with universal design for learning. They include not just what standards are being taught, but also the SEL competencies, the social emotional learning competencies that are being reinforced by the lesson. And they also connect to other content areas outside of health. All of those resources are available on the California Health Education website. Again, open access. If you just click on the educator tab, it's by grade level, and it'll provide all of those supports for you and all of those resources and more that you could access. I also wanted to share that the Orange County Department of Education has also, these are hot off the press, that we've just created these one-pagers. They're available in 7 languages. And we also have some social media posts that are available that anybody could access. Please don't hesitate to reach out. We are a community that are really working very hard to support high quality health education. And we're here for all of our educators who are doing a great job trying to support our students and our families on all school campuses across the state. Thank you so much.
Doreen, what a wealth of resources you've offered here today. Thank you so much. And our LEAs and our partners that are on the call really appreciate all you've shared here with us today, as well of all our partners. I know our superintendent is on. I know he wanted to come back on. There he is, Superintendent Thurman.
Thank you, Superintendent Guillen. I just wanted to thank all the partners, as you have indicated, Belle, for the incredible resources. Thank you, Doreen, for that great stuff that you just shared. And thank you to Dr. Sood and to Aaron and to Madison. And of course, Lauren, thank you. We thank you, and our hearts go out to all the families that have experienced a loss. We're grateful that you all are trying to create a different legacy for other students. Thank you for that. I did want to also thank those who have been participating today, and I saw there's a robust level of interest in the chat and a lot of interest in what do we do to provide more counseling supports. And we all agree, the state is mobilizing in general to expand counseling, recognizing how much young people have been through even just since the pandemic. And so if you didn't know, the state is rolling out a $4 billion community schools program of about, I think, some $500 million already allocated to school districts. What that means is that districts can get access to more health, mental health, all kinds of support services, anything that is defined as a need at the school level. The state is also working, we've secured funding to recruit 10,000 more counselors who will work in our schools. And for anyone who knows someone who might want to become a mental health clinician in our schools, we actually have a scholarship to help you do that. $20,000 is available in grants for those who want to become mental health clinicians and work in our schools and commit to at least 2 years in schools. The way to do that is to go to mhclinician@cde.ca.gov. I'm sorry, check that. That's mhcounselors@cde.ca.gov. Thank you to Maria and the communications team for today and for putting that in the chat. mhcounselors@cde.ca.gov, and someone can get back to you about how you can become a school-based mental health clinician. And so there are many ways that we're working to expand services. We'll keep doing that, especially around the fentanyl needs, as well as engaging youth and families on ways to promote more education and prevention. So thanks again. Thank you for being a great facilitator of our conversation. Superintendent Guillen, back to you.
Thank you so much, Superintendent Thurman. Thank you for being here and again for convening us. And thank you to all our partners. And thank you all to you for taking part of your day to joining us for this very important conversation. We wish we had more time, and certainly we will continue to provide information and assistance to you all. We hope you take the information you heard here today and share it widely with your LEAs and everyone that supports our young people throughout the state, and share it far and wide. We will have this information up on our CDE website shortly. We do need to make sure that it meets ADA requirements. And we will also have this information, it's up now actually on our Facebook feed, on our CDE Facebook Live page. So you can access that information there. We will also be posting the slides and other information that you can use. We know it's a lot of information to receive in a short amount of time, but we wanted to say thank you for all the work that you do for our young people across the state. I wanted to express my gratitude and appreciation to our emergency services team, Jake, Joe. We have a small team that does a lot. Our communications team that helped put this event together, our communications team, and everyone who participated in the panel today. So on behalf of the Operations and Administration Branch here at CDE, on behalf of Superintendent Tony Thurman, thank you so much. And again, thank you for all you do for our young people. Have a great rest of your week. Take care.